that most of us know the stretches that we should be doing, but the issue is that we don't actually do them or we don't actually hold them long enough. So I'm gonna go with you guys today through a very quick little stretch routine. We're just gonna focus on 3 stretches for the hips because I know a lot of people have been complaining of tight hips. From that seated position, open the legs up nice and wide. Gonna look a little bit different for everybody. You go to whatever is comfortable for you. And then I want you to hinge forward at the hips. Walk the hands down. Maybe you stop here, maybe that's where you feel the stretch. The point is to get that nice flat back. And as you walk it down, you go as comfortably low as you can. You should feel that stretch through the back of the thighs and then maybe a little bit on the inside as you lean forward in those hips. So we're really rolling the hips forward, flattening out the back, leading with that chest. And then we're just gonna hold it right here. So sometimes it feels like we're getting a good stretch when we go right into the movement and then come right out of it. But to make the actual changes in tissue length, you have to hold a stretch for 2 to 3 minutes. So that means if we're in that maintenance phase, it's okay if we're going through those 3 rounds of 30 seconds. But if we're trying to make actual changes, then you need to hold that stretch a little longer. So inhale, take it up just a little bit. And then exhale, sink into that stretch a little bit deeper. Now maybe you find a spot today or a stretch today where you want to hold it a little bit longer. Your body's asking for a little bit more. Totally cool. Go ahead and do that and do whatever your body needs. The biggest thing with anything rehab recovery is learning how to listen to the body. Your body's always going to tell you what it wants and what it needs. We just get so good at tuning it out that we have to find that voice again. So with every exhale, maybe you're trying to get a little bit lower into that stretch, just doing whatever feels good, nothing forced. And then we've got one more right here. So walk those hands back up and take it all the way down. This one's gonna be your deepest, lowest stretch yet. Now those muscles are starting to get warmed up. They're a little loose. Maybe you're doing this after a workout and they're already loose. Maybe you're doing this first thing in the morning and you're super tight. Might be different for you based on the day. Today could be totally different than how you feel tomorrow, especially if you do these stretches consistently. Okay, one last big deep breath in. And then exhale, can you get just maybe a millimeter further into that stretch? If you can, let's do it now. Okay, and then walk those hands up. You're gonna come into that fully seated position, and then we're gonna take it down onto our backs. So we're gonna get into that piriformis, which is on the outside of the hip. Okay, you're gonna cross the foot over the knee, and then if you can tolerate it and it feels good, take that opposite knee. So for me right now, that right knee in towards the chest. I'm giving a little bit of pressure with my elbow to open up that left leg, but I'm still not forcing anything. So I'm not yanking this leg in towards my body. I'm going just to the point where I start to feel that stretch, and then I'm gonna hold it right there. We're gonna do all 3 stretches on one side, and then we'll switch over to the other side, just because once you start to get that mobility and the tissue starts to soften a little, if you keep switching back from side to side, then it's almost like you're starting right over. So from here, if we just come out of that stretch a little bit, take a nice deep breath, exhale, hug it right back in and go into it. We're getting closer to that 1.5 to 2 minute stretch that I talked about for making tissue length changes.